Okay, giving bad news. With patients with an untreatable condition, be aware that giving bad news is known to be difficult for practitioners and can cause some clinicians to delay or avoid it or provide overlying optimistic information. Remember that although the information will be very sad for the patients, they need factual, honest information provided empathetically to properly plan for the future. Points to consider include the following. Indicate the eye examination has finished and you wish to discuss your finding. You may put down your pen and even turn off the projector chart. Make eye contact with the patient and make sure that the patient is comfortable and attentive. It can be helpful to have some tissues ready in case the patient becomes upset. It can be very useful to explain all this information to one or two family members if they are present, and if the patient is happy for you to do so. Introduce your diagnosis by reminding the patients of their symptoms and then link them with the diagnosis. Explain what the eye disease is in simple lay terms. Give example. Give the patients time to digest the information and encourage them to ask questions. 3. For patients with macular degeneration, for example, you should explain that they will not go blind and should keep their peripheral vision. However, at the same time, you must be honest and do not attempt to avoid difficult questions or even sugar the pill. Indicate their central vision, detailed visions that allows them to drive, read, and see faces is likely to get worse. Blunt statements such as "I am afraid that there is nothing more that we can do" are not helpful. This may be correct for conventional treatment with glasses, but low vision aids may be helpful for a variety of tasks. Household modifications can be made and smoking cessations can slow progressions. Note that there is some debate regarding the usefulness of multivitamin supplements. 4. Empathetic statements such as "I know this is not what you wanted to hear. I wish the news were better" can be helpful. 5. You need to be aware of the possible emotional responses to such news. Various models have been proposed and common models suggest stages of denial, anger, bargaining, depression, and acceptance. These stages are not universal, and some patients skip stages while others get stuck at a particular stage. In the denial stage, patients will often seek a second opinion. You should not see this as a slight on your ability as a clinician, and you may even suggest it to a patient who is openly in denial when you first tell them the news. Explain the prevalence of the condition. This indicates that they are not alone. It can be useful at this point to discuss support groups and local agency. Discuss availability of low vision aids and what help they can provide. In this respect, remember the stages of response to vision loss. Patients are unlikely to have a motivation to successfully use low vision aids when depressed. Do not give up these patients, and when they overcome the depression and accept their vision loss, low vision aids may be usefully provided. 8. Information leaflets and or websites are particularly useful in these situations.